Professor Amit Vishwadhyabhitam, University from Coimbatore, to kindly share his valuable insights with us.
Sir, Sendil sir, whether
So shall we start?
yeah, sir, sure.
Fine. 1 second.
Is not coming, sir.
Okay.
Sir, whether you are able to share the presentation, sir?
Yeah, I'm sharing science.
Yeah.
Okay. So good evening to you all. Let me share the screen.
Sir, please check voice, sir. Sound is irritating.
What is happening, sir?
Sir, voice is audible, sir. Your voice is audible, clear.
Sir,
Sendil sir, your voice is audible. You can start.
Okay, fine.
Sir, good evening, bro, sir.
So good evening, sir. We can start.
Yes, sir, we can start, sir.
Okay. So thank you to all. I will be discussing on two aspects in today's session. One aspect is more into the emotional well-being of the system in the sense like we talk about faculties and how we are interacting with the students, and we will also try to see some perspectives about how more reliable systems can be suggested. The topic chosen is a sustainable goal part. Give me a second. Sir, is it audible now? Sir, can you confirm, is it audible?
Yes, sir, it is audible, sir.
Okay, fine. Okay, let's go with the session. See, the topic that is given to me is more into understanding of an SDG goal. So all of you know, like today we talk about SDG, and that's more about how we are looking at aspects of building the common characteristics what the nation is focusing on, right? So if you go to the internet and start searching on SDG goals, you will find the top 17 SDG goals, and this top 17 SDG goals are more from what every country around the world is looking on. So today, two sessions from my side will focus about this SDG goals, and we'll also try to give some sort of impact or understanding on how we as people from computer science can actually do something in contribution to this SDG goals. If you can come down and see the different SDG goals, each one of the SDG goal will have a thought process for building the country. So more important thing is today when you look at most of the the research proposals are also aligned towards the SDG goals. So first, let's understand the reason for why we have SDG goals. The two SDG goals that I'll be looking into the session is, sir, is my screen visible? Sir?
Yes, sir.
Okay, fine. So two aspects which I will be looking into is, one is the good health and well-being, and second is a quality education. If you look at the good health and well-being, as you can see from the screen, we are interested in talking about saying, can we ensure healthy lives and promote well-being for all at all the ages, right? So please understand this. We want to talk about healthy lives and promote well-being for all ages. When we go inside and see more information about this SDG goals, this SDG goals start saying that we need to look at possibilities of discussions about how to bring in the health aspects, the more health aspects that we are looking at from what we have and what is getting declined. See, whenever we say that there is a health that is in existence, there is always a factor to say that the health is also getting degraded, right? So this SDG goal focuses more about how actually you can look into the health aspect and more into the well-being of the common people, right? And when we submit proposals also, today we have proposal calls which is more related to this SDG goals. Let's come into this thought process and see what we can do from an SDG goal perspective. See, I have aligned my session from two aspects. One is when we look at this health and well-being, I'm trying to look at aspects of how this health and well-being can be considered. See, since we are trying to look at a target statement saying that we are looking at a possibility of ensuring healthy lives and promote well-being for all at all ages, right? So our requirement is like what we are interested in targeting. When we say what we are interested in targeting, then the possibilities would be like what are the different actions that could be taken care. Now, each of the SDG goals actually focuses on specific aspects. So we will look at possible aspects of how health and well-being can be taken care. Now, when we go to the next thought process and ask, okay, Google, saying, okay, your health and well-being is what we are talking about. So we say SDG, I'm going from something basic, then I will slowly come to the discussions technically. When we ask, okay, SDG and health being, right? Okay, what is the government plans related to this SDG goal, right? Let's take, we ask, since we stay in India, so let's look at what is the government plans with respect to this SDG goals. So they will actually immediately bring in the aspects with respect to the SDG goals which government is talking about. So here, one thing that you would see here is the different schemes the government is trying to bring in to concentrate on this SDG goals, right? As you can see here, each SDG goal that is being discussed by the government is being taken care by a ministry, and there are some schemes that runs under this SDG goal, and there are some interventions and there are some targets. So whenever we say that there is an SDG goal, then the target proposed from the government is more related to say, okay, what will be the outcome of this SDG goal? For example, you take a case where you say you want to end poverty in all forms everywhere, then the target would be like by 2030, the government says that they want to eradicate poverty for all people everywhere, currently measured as people living less than 1.5, right, in consumption per day, right? Okay, so like this, each SDG goal, right, has got some proposition factors from the government, and each SDG goal has a ministry that works for it. So my request to the people is, when you are looking at possibilities of looking into all these SDGs, if you are a researcher or basically you are looking at somewhere where you are a product developer, look at the SDG goal and see the targeted schemes, right? Based on that schemes, you can also slightly realign your SDG goal for your problem. Okay. This is first thing which I want to all of you to know. Now, next is this SDG goal that we are talking about, health and well-being. When you type here, you will automatically see this something called as SDG Health India, right? -mohfw.in. So when you go inside this and see, this will talk about more about what is this SDGs outcome. So we'll enable the link. Okay. Yeah, proceed. Right. So when you look into this, this will actually say what is the ministry's journey towards achieving this SDG by 2030. This is a very good portal which all of us should have a look at, right? Since we are talking about health and well-being here. Now here, the important things the government is focusing is more towards how this SDG can be implemented. We are talking about SDG 3, which is good health and well-being here. So if you look at this aspects of this SDG here, they talk about one aspect which is the indicator framework, right? So this indicator framework for the SDG actually says what you are interested in providing as part of the SDG. So we are talking about SDG 3, where we talk about ensure healthy lives and promote well-being for all at all ages, right? So let's go and expand this. Now let's see the targets that is being proposed. Now, the targets, as you can see here, it says by 2030, they want to reduce the global maternal mortality ratio to less than 70% per 1 lakh live births, right? So this is one factor that the government is interested in looking at. Second thing is, by 2030, that government feels they want to end preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality at least as low as 12% per 1,000 living births, right? So most of the things sometimes we cannot address, but we can always give some solutions. Now let's look at the next one. By 2030, in the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combat hepatitis, waterborne diseases, and other communicable diseases here, right? So they say, as per the inference says there is a malaria incidence per 1,000 people living in the country, right? So we will take this one. Okay, I'm going in discussion more in detail so that you can get a feel, okay, what you can contribute as research community who has joined the session, right? Okay, so I'm taking this SDG action one, okay, which feels okay, there is a need for some kind of research or understanding from all of us. The next is by 2030, reduce one-third premature mortality for non-commutable diseases through prevention and treatment and promote mental health and well-being. So this also I'm taking it for reference. I'll say why. Because this is something which all researchers can actually contribute here. So non-commutable diseases. So let me take this statement. This is second. Okay. So this is second. Okay, fine. Now, next, strengthen the prevention and treatment of substance abuse, including neurologic drug abuse and harmful use of alcohol. This we do not have direct aspect. Most possibly today, Department of Environmental Science or people who work on common societal problems, they propose possibility of centers which actually treats people who are into alcohol or drug abuse. This I'm not taking here. Next, by 2020, half the number of global deaths and injuries from road traffic incidents. So let's take this part, okay? Because this says the death rate due to road traffic injuries is high. So we will take this one also, right? We will take this one also. Sir, am I audible? Please acknowledge. Sir,
Yes. Yes, sir.
sir,
You are audible, sir.
okay, fine. Now we we are interested in actually seeing the next one. Ensure universal access to sexual and reproductive healthcare services, including family planning, education, all that. This is again slightly out of focus for research from computer science. I'm not taking that. Next is achieve universal health coverage, including financial risk protection, access to essential quality healthcare services, and access to safe, effective, and affordable essential medicines and vaccines for all, right? So here, let's take this. This we cannot do it very big, but we can actually look at the possibility of the problem. Okay, so I'm putting this also for inference. So the fourth one, I'm just marking it as asterisk because it needs. Okay, I'm just marking it with hyphen so that it needs some more understanding, right? Next is substantially reduce the number of death and illness from hazardous chemicals and air, water, and soil pollution and contamination. So here I'm just taking this, okay, but here from computer science, or basically people who work on research can actually target this as one of the outcome or analysis with respect to air pollution. Okay, right. Okay, right. Now, next is strengthen the implementation of WHO framework on tobacco control. This is slightly out of us. The next is support the research and development of vaccines and medicines for commutable and non-commutable diseases. This I'm not taking. The next, if you can see here, substantially increase health financing and the recruitment and the development and training and the retention of the health workforce in developing countries, especially in least developed countries and small island developing states, right? This one I'm just taking here because there's a need for health worker density and distribution, right? So let's keep it here. Okay, right. Last in the list, which you can see here, is strengthen the capacity of all countries, in particular developing countries, for early warning, risk reduction, and management of national and global health risk. Right? This speaks more about health emergency preparedness and preparedness of bloodstream infections, all that. So this I'm not taking. Now, from what is being suggested in this SDG outcomes, I've selected a couple of things which I felt is meaningful for discussion. So let's take one by one. Right now, let's take the first one here. Right. Okay. Now, here, the what I'm trying to take here is diseases which are basically waterborne diseases. Okay. And next is neglected tropical diseases. Two things I'm trying to talk about. And most important is communicable diseases. So let's take this one. Right. So let's take our discussion towards this. So here, so, so let's talk about. Right. So let's see what is this communicable diseases, right? Communicable diseases are illness that is caused by germs, which can be virus, bacteria, fungi, or parasites that spread from one person to another, right? Okay. Here, as far as common examples of such diseases, which we have been experiencing as pandemic is, which is COVID, right? COVID-19, which we have been experiencing. Now we are all free of things. Now, our question would be is like, when you look at such diseases, what kind of research can be done? Okay. So I'm going to the same one and I'm now trying to see possibilities of this disease, right? Which is communicable diseases, right? So when we look at such diseases, then where does this disease spread, right? One possibility of spreading of this disease is from water, right? One possibility of disease spreading is from water. So maybe if you are actually interested and you say, okay, I'm interested in proposing a solution for it, your solution that you could propose would be is to basically look into the water and the quality of water that you consume, right? Okay. So one that we are trying to bring in here is quality of water, right? Okay. And second that you can always look into is like, okay, see, everybody washes hands, right? But are you very sure that your hand wash is being perfect or not, right? So their possibility would be like, can I actually look at using an AI, right, for checking the quality of hand wash, right? AI for checking the quality of hand wash, right? So now these are the two things that we can actually look at. Now let's take it one by one. First one that we are saying is we need to look at the quality of water, and second thing is AI for checking quality of hand wash. Now, when somebody says water quality has to be tested, then people will say that each one of us are consuming water from good resources. The resources could be one that you could have with your water heaters, or possibly today we have sterilized water machines and so on, right? But even after that, people have a question like whether your quality of water is good or not. Now, here, let's ask a question. If somebody says, okay, I'm interested in consuming water and the quality of water is being taken as good or not, then can you actually go for image processing approaches to find out whether the quality of water is there or not, right? So let's go from here. There is some already ongoing work, so you can actually take it from there itself. I'm just going to the chat GPT for your reference. So I'm just asking chat GPT whether can we actually have quality of water test, right? Quality of water test using images. Okay. Quality of water test using images. Now, if you ask ChatGPT on this question, it will automatically say that yes, you can actually look into the quality of water basically using the images itself, right? As you can, if you can scroll down and see here, it will say that there's a possibility to look at color, right? So you take an image of a water, and if it's basically green, then you can assume that there is some nutrients problem. Yellowish, again, it has got some organic water, organic matter. Blackish, then it means that it is having some industrial pollution waste, right? Now, the next would be the turbidity factor, right? So this you cannot see through the water in an image, right? So this is ruled out for us. Now, the next is you can see when you are looking at water being mixed up, people will say that it is showing some components of medical or detergents being mixed there. So there again, can we actually see how much amount of quantity of waste is being mixed up so that a possible mechanism could be thought to clear the waste from the water, right? The next is possibility of seeing whether there's a good quality water. So their answer would be is like, can you find something with respect to fish and aquatic plants, right? If there is fishes and there is aquatic plants visible in the water, then you can actually say there is a good reasonable quality in the water that you're taking here, right? But whereas if you're having something like dead fishes, it means that there's no vegetation, and it means that there is a pollution or there's an oxygen depletion happening there, right? So this too actually you can look at a possible research plan, right? When somebody says I'm actually having a image of a pond, then I see some fishes, the fishes are moving healthily, I see some aquatic plants, then I can say there's a good quality in water. But you say that there's a pond, but I see fishes floating. It's not alive. There's no vegetation there. Then I can conclude that it has a pollution or it has an oxygen depletion here. One second. Okay, so now when somebody says I'm actually having an image of a floating water and I could see some fishes live, then I can say quality is good. Otherwise, I can say no, quality is not good, right? So next that you can find would be deposits on the water. You see some physical deposits. That is also one good answer here. So image-based water testing will give you only primary results, but for real accuracy, lab tests can be provided. So now somebody would ask a question, where can I go for this possibility of such solutions, right? Okay. Now answer is very simple. Let's take there is a flooded place, right? and that flooded place is having some water deposits. Like you can see that there's a disaster. There could be a lot of waste coming out. Water could get polluted. Now somebody wants to actually see whether there is a possibility of good water or a bad water, right? There, if you can employ a drone, and the drone as such can actually use some sort of images. That image could actually say, I could see some fishes, that I could see some plants. Then actually you can conclude that the water is good, right? The second aspect is from an SDG perspective, I'm talking about. Let's say the government wants to find out the ponds, right? And wants to actually take some decisions, which are all ponds which are clean, which are all ponds which are not clean. Then the government as such can actually employ a drone. And using the drone can capture some information on the quality of water by taking images on the pond. So the image would say, I see a fish, I see some aquatic plants, that means the pond is very neatly maintained. But I don't see fishes, but whereas I see some deposits like what we see here, then naturally I can conclude that the quality of water in the pond is not good, right? So this is answer to the this as a solution, right? So here what we are trying to talk about is quality of water. So the thought process is, can you actually do this with respect to pond and talk about the quality of pond in a particular place, right? It could be a city also. So here suggestion is like you can employ drones to test the quality. Okay. Now, second one would be is AI for checking the quality of hand wash, because when you talk about airborne diseases actually get transmitted because there is not a proper hand wash also. So there are now systems which actually takes care of suggesting whether there is a airborne disease here or not. So let's ask the chat GPT itself. So it'll give you clarity here. So I say systems for checking hand wash quality, right? Systems for checking hand wash quality, right? So if you ask ChatGPT, then it will say you that yes, there are some systems. So as you can see here, one systems that is being deployed right now is fluorescent dye and UV light systems. Okay, right? Then as you scroll down, okay, you will find this one, which is what I want people to have a look at. AI or camera based hand hygiene monitoring systems, right? So what happens in such a case would be like if somebody is washing the hands and the hands is not sufficiently washed properly, then automatically it will try to go and check and say whether there's a piece of dust which can actually carry the disease, because that disease as such would be getting commuted to the body. Because if it is the kid would try to keep the finger in the mouth or move in the face, or the kid would try to give a handshake to another kid. So there's a possibility for such diseases could be transmitted. Now let's go and see how these systems work, right? This is part of research which is getting improved a lot. 5 years, 6 years back, people would say that okay, it is just a thought process, but now we are having it as kind of systems. Now, if you look at this system is being employed in the hospitals also. So again, some access error. So yes, okay. So we can just see here. So in this work, they say that we propose to deploy depth sensors in hospital settings and use computer vision systems to enable AI-assisted healthcare, right? So you can find more details on it on here. Yeah, yeah. So you can see here. This is one of the product from a company. So as you can see, most people don't wash properly. So you gave a 20-second timeline for the soap. Then the depth vision sensor will check whether you are washing your hands properly or not, right? And your depth vision sensor will conclude whether your wash is done correctly. See here, you are given 20 seconds time. So under the 20 seconds time, the depth vision sensor will conclude you've done a proper hand wash or not. Okay. So the learning here is there are AI systems that are coming up right now, and these AI systems are able to monitor your hand wash quality. Okay. So that's something as second. So this is what I feel as could be a solution which people in IT or computer science can actually think of doing, right? You can actually think, okay, can you employ systems which are going to be taking care of all these computable diseases, and that systems could actually be an AI powered system also, right? That system could be an AI powered system. Now let's go into the next one. By 2030, reduce by one third premature mortality for non-communicable diseases through prevention and treatment and promote mental health and well-being. Okay, right. So this area, I'm not very big expert, but if you can see here, recently when we discuss with certain doctors, there are a lot of research that is coming up with respect to AI with premature mortality research, right? So I will show you a case here. So right. So usually the organizations that work, right, the most promising organization is Indian Council of Medical Research. They work more on this line. So if you see here ICMR, and there you search for, yeah, premature mortality, right, research. Okay. So you ask ICMR on what do they do in premature mortality research. So here, one, they would actually talk about the type of diseases that they are looking in. But if you see the research calls that are coming up right now in ICMR, they also look more of the proposals which are talking about systems for identifying premature mortality, right? So let's change this here. So AI based systems, AI based systems for premature mortality research. Yes. So here, this is also taken up as one of the aspects here. So people say, can you actually look at possibility of AI also as a solution for understanding the mortality rates? You can see here, there's a good publication also from and artificial intelligence. I think somebody's audio is on. Please check. An artificial intelligence model to predict mortality among hemodialysis patients, right? A retrospective validated cohort study. This paper is open, so people can have a look at this also. But please always understand when you do such research, please always have a doctor with whom you're collaborating and you're doing your research. So the input I'm giving to the people here is you can actually use AI as a kind of approach to understand how the um, premature mortality can be kind of reduced, right? Okay. And see, the other thing is like this again is again a debating discussion nowadays, because people say that the type of living style people follow, right, is also contributing to such problems, right? So I'm not coming into any type of living styles. The statement here is very simple. The type of living styles people follow is also contributing to difficulties arising because of all this premature mortality issues, right? Okay. Then let's come to the next part. By 2020, half the number of global death and injury from road traffic accidents. Okay, so this is something which is very much in need, because the amount of death and injuries in road traffic accidents are very high. Right now, if you see it as a common statement, it might not be very interesting. But I'll show you how, from the research perspective, it has got a lot of value. right? Because my PhD scholars also work in the same area of road traffic accident analysis, but we work more from a computer vision system perspective, right? So let's ask here with the chat GPT, ask, okay, AI system for road traffic accidents. Okay, so AI system for road traffic accidents. Okay, right. Now, if you ask here, they would actually come up immediately to this website, which is indiaai.gov.in, which each one of you should see, right? Where they say government is looking at possibilities of intelligent traffic management system, wherein they will use all concepts that is there, like machine learning, IoT, artificial intelligence, like that, right? And using that, they would like to make sure that the amount of traffic is being maintained, wherein the accidents is also getting reduced, right? Now, if you see the reason for accidents, right? Because we have to go back and start asking a question. Okay, we are talking about accidents. So, what is the reason for a road traffic accident, right? So let's take this statement. So we'll go to ChatGPT and ask this question in ChatGPT, right? So, road traffic accident. Okay, road traffic accident. Right. Right. So if you ask a road traffic accident, a ChatGPT will immediately give an answer very simply saying that it is a motor vehicle accident occurs when a vehicle collides with another vehicle, or it can be a pedestrian, or it can be an animal or a stationary object, right? So now this is where we have some role to play, right? Now let's pick this here, right, and put it here. Okay, because we cannot go around as traffic police or regulation authorities. At research community level, what we can do. Now, if you can see here, the road traffic accident called as a motor vehicle accident occurs when the vehicle collides with another vehicle. And second is pedestrians, animal or stationary object. Okay. So what we need is, we need actually systems which can actually detect all of this. What is that it needs to detect? It needs to detect which is whether there is a vehicle in front, right? Fine. The next is we need to find out whether there is a pedestrian on the road. Pedestrian on the road. Second is it needs to find out whether there's an animal, right? And fourth is it needs to find any stationary object. So we will call it as an object, right? Okay. So now let's take what happens when you look from a research perspective. See, when you say that you want to find a vehicle in front, immediate answer is yes, vehicle actually I can find out whenever I'm just using my vehicle, I can see it with my eye itself. But assume that if your environment is totally dark, right? Let's take you are driving on a hilly road, or let's take you are driving, but suddenly the street lights have gone down, right? So the interesting thing is, can a vehicle find out the vehicle in front? Answer is yes, my lights are on. Naturally, I can find a vehicle. But the other possibility would be is like, let's take there's a vehicle in front, but the vehicle is not seen, because most of the accidents that you can see nowadays are basically accidents where vehicle goes and hits another vehicle, which is not being driven, but it is stopped, right? People are driving in night and suddenly they sleep or suddenly they move left or right. There's a vehicle on the road which is stopped, which is not moving. So the vehicle goes and hits the other vehicle. So here, what is happening right now is people are looking at basically sensor-based solutions. Using the sensor-based solutions, they are trying to propose possibilities to find out, I find a vehicle at this distance. So naturally, my vehicle that I am driving needs to be stopped, right? This is some solutions which are people being proposed from the car manufacturers also. Second thing is the pedestrians, right? See, pedestrians as such, generally the accidents in pedestrians occur when you are driving on a full road where the road is basically empty, right? Where your speed is under control, but if you feel that it is under control, it is controlled because there is nobody on the road. But assume that if it's an empty road and the context is nobody's on the road, but suddenly a person is running from left to right on the road, right? So naturally, is it possible to find out there is a pedestrian who is going to come, okay, and automatically inform your vehicle so that the speed of the vehicle can be reduced, right? That's again an open challenge, because when you drive on such roads nowadays with the planned roads that we have in government, right, very neatly put roads, the cameras has to be acquiring data from left and right to say there is an intelligent camera system which says to the driver there is somebody coming from left, so naturally your vehicle has to slow down, right? But still, we can believe that in future we'll have such powerful systems also. The next most important thing is animal, right? So you can see in cases where people say dogs being hit by vehicle, dogs being hit by bikes. Okay, it automatically topples a vehicle sometimes. So can you actually find where is an animal? Can you find whether there is an animal is going to run from a left to right? Can you detect the animal? More importantly, on the hilly roads, right? On hilly roads, it's very much risky because you cannot take left side, right side, nor you can come down on the hilly road. So can you find an animal which is standing in the next left bend, wherein you can say that, yes, I will just stop my car or I can take a pause and then drive. AI systems can really do a big role there. The next important thing is objects. You can see that vehicles, when it is being driven, they hit with other objects. So what can be the objects? The objects that you could talk about would be like objects which are on the road, right? One, objects which can be on the road. What can be the objects which can be on the road? Let's take somebody puts a box on the road, right? And the box is not visible in the view of the car. And the car slides over the box, automatically the car is losing control. Same thing, there's a box on the road and the bike takes over the box, right? That bike is not able to see it because it's little darker. Again, the vehicle is going out of control. Or the other object would be like any object which is actually disturbing the normal driving pattern of the person on the road. There you can actually look at possibility saying that this object has to be detected. So here, thanks to AI, now we got a lot of object classifiers which are being developed. So one possible classifier which people will be talking to you all from research perspective is a YOLO. People will say you can actually use a YOLO classifier and you can actually detect an object whichever is there, right? So if all this is going well, then naturally we are trying to conclude in our discussion saying a computer vision system, right, which actually is being employed on the cameras, which is on the street light roads, or a computer vision system which is employed on the vehicle can actually monitor something on the road and can take some quick actions where the speed of the vehicle can be reduced, right? Or it can actually try to inform the other vehicle which is coming in the opposite direction saying there is a vehicle coming at this direction from this speed. So this also could be a good solution which people can talk about. That means two or more vehicles interacting with speed alone. One vehicle says I'm driving at this speed, other vehicle says I'm driving at this speed from an opposite direction. Can they be connected? Can it be informed saying that the speed of the vehicle can be reduced or not? If this happens, then we are giving a solution to the road traffic accident, right? Then next is achieve universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, essential, effective, quality, and essential medicines and vaccines to all. I think this is something which I think the government is already in process where the government says that, okay, they have started opening their own healthcare clinics. As part of it, they are trying to give subsidized medicines and subsidized vaccine to the people. So it means that whenever people have a problem, they need not have a high financial requirement. The government clinics will take care. I think somebody's audio is on. Please check, please. Somebody's audio is on, please. Okay. Hello. Participant. Somebody's audio
Sir,
is on.
we have
Okay, fine.
muted all the audios. Sure.
Okay, fine, sir. Fine. Okay. Now, when we look at this, health coverage aspect. Now the government as such has got a lot of health coverage schemes where they talk from health coverage from normal people to pensioners. Every living people today has a health coverage scheme which is affordable. So this health coverage schemes, right, which is being proposed, also gives some benefits to the people, saying that they can procure medicines, they can actually go for surgeries and so on, right? And interesting thing which I think which people should be understanding right now is there is now health coverage for all the maternity also, right? I think if you talk about 15, 20 years back, the health coverage was not covering under the maternity part as much I know. But recent health coverage schemes proposed from government or from private sectors are also taking care of the maternity aspects also, right? So every living people, okay, naturally under a family will expect a health coverage under that also. So I feel there's an universal health coverage which is already in existence from government side. Now, where this is basically getting difficult is on the new type of diseases that comes up, right? So any new diseases that comes up, which could be a communicable disease or a non-communicable disease, that needs to be addressed over the period of time, right? The next is by 2030, substantially reduce the number of death and illness from hazardous chemicals and air, water, soil pollution, and contamination, right? So here I'm actually looking at soil pollution and air pollution, right? One is soil pollution and next is air pollution. Okay. This is being a very interesting research because people say that we have land, but land doesn't have plants. People say I have land, but the plants are not growing. People say I have land, but plants are growing, but they don't have a proper yield, right? All of this are basically going into the soil pollution aspect, right? Here, there's a lot of systems that's come up. Most interesting systems that you can see right now is are basically the soil health checkers, right? You can actually see it under the chat GPT. Today, a lot of products are coming from agricultural universities with joint research, right? So soil quality checkers, right? Okay, so soil quality checker. So you can say you can see very well here where soil quality checker will be a system, device, or a method used to analyze the soil properties to determine its health, fertility, and suitability for agriculture, gardening, or environmental use. Right now, a lot of people will have a doubt: why are we talking about soil quality when we talk about the health and well-being? Reason is all of us are consuming vegetables, and the vegetables are fruits that you consume or anything that you consume as part of agriculture largely depends on the soil where you're being planted. So if the soil quality is good, naturally you can expect the food that you take is also good, right? So here now there's a big inclination from people going from consumption of foods towards organic foods. Okay, right? People say if there's a point, if there is something which is being grown as organic, then naturally the organic foods are going to have a lot of soil fertility. Naturally, the health aspect is also better. So types of soil quality checkers. One people what they do is like you can actually see people taking soil and they will try to actually take to the lab and they'll try to do a chemical analysis. And when they do a chemical analysis, again here what you see here is something called as a rule-based system where they say, okay, the quality of the soil is good, bad, because something is missing, something is not missing. Second thing that has come recently, or people have started using, is portable soil test kits, right? Like you say, portable blood test kits, you know. Now we got portable soil test kits. So, which will actually allow you to actually be using under the farm, wherein you can see how much is the quality of soil is there. The next is we got sensors, which are basically handheld meters, which actually can give you the quality of the soil. Last one is the image based systems where you actually employ drone or you employ camera and make the data to be captured. Based on the data that you capture, you come back with some results saying what is the quality of soil that you are working on, right? Okay. That's a fourth one, which is a image based system. So welcoming research where I find the computer science people recently have started working on is in the image based systems where they are trying to use a camera or a drone to capture the soil plant images, right? So here we will go one step forward, right? Right. Okay. So and start asking, do we have soil image data? Because a lot of people will actually have this question. Okay, I'm interested to do some research. Okay, do I have a data set of soil images all there? Yes. You can see ChatGPT will actually say yes, I can give you some images what you want. So as far as the soil images are concerned, you can actually say, okay, what type of image that you want. So I say I want to have soil images for quality analysis. Okay, I say soil images for quality analysis, right? Soil images for quality analysis. So here, as such, we will see that, okay, there is a lot of people trying to process, so it might take a time, but we will have an image whenever it is being ready. So let's go from here. Okay, I'll give you the other way of taking the data set. So we will go to IEEE data port, right? As for soil image dataset. Right. IEEE Dataport is a very good resource for people who want to do research. There I'm asking, okay, do I have, yeah, you can see here. Okay. This is where, you can see ChatGPT is also might not give an answer. When we asked ChatGPT, it said, okay, people are trying, we are yet to get some data, but you can actually be very intelligent. You go and search, you will find data set in IEEE Dataport where they give you very good details about Indian soil image database. Okay, right. This is being done with one professor, I think, from NIT Silchar. Okay, fine. You also can contribute. This should be an info for all of you. If you have your own data set and you would like to contribute, irrespective of the research area that you work, this is one good resource where you can publish your data set. The advantage would be is like you'll be in the visibility of people, and people will try to reach you also for collaborations because your data set might be very helpful for the research. Okay, so now what I'm trying to uh, put up for people would be is like, okay, you can actually look at soil pollution also by looking at the quality of images of soil, and from there you can conclude what type of soil quality you're working on. Air pollution research, actually it is not very new. It is being done, but still air pollution research right now is taken as a multimodal analysis, right? For example, if you actually go here and start searching for an air pollution data, you will get a lot of air pollution data because government also announces the air pollution index, right? So air pollution index of different places, right? Air pollution index of different places. Okay, fine. So this will give you more important factors of, okay, what is a most clean states, which is not a clean state, and so on, right? Now, what we need is like we need to actually understand what is the air quality values, right? This you can actually get it from data.gov.in, where you can actually go and see for air quality values from different places. You can actually go and download the data set. In fact, if you're a coder, you can actually use this API and you can try to take values of the air quality. In case you are looking at visualizing something, then naturally you can use this part also, right? Here they would have show you for Delhi because Delhi is most sometimes discussed about the air pollution values, right? Okay. Now the point I'm leaving here is open to discussion and research. People can actually look at possibilities of doing research where you are looking at the air quality parameters or you are looking at the soil quality parameters. Now the last one under this SDG is substantially increasing the health financing and the recruitment and the development and training and retention of health workforce in developing countries, especially in least developed countries and small island developing states. Okay. So here the thought process is like, okay, can you actually have a clinical workforce? How I'm putting is for discussion is something called as a clinical workforce. So what is a clinical workforce? A clinical workforce, what I'm trying to say is like, okay, I cannot have a clinic at that place because that place is very much not accessible. But can you actually have a clinical workforce? The clinical workforce would be basically the frontline workers. Okay, the clinical workforce would be the frontline workers. So what these frontline workers can actually do? The frontline workers can be educated with something what you want, and the education can actually help them to start serving for the people there, right? For example, if it is an underdeveloped country or being a developed country but has lot of financial difficulties in employing lot of people for health, the suggestion would be is like, can you actually have a mobile app wherein the app as such can recognize some problems which is happening at that particular place. So what can that app actually do, right? So mobile app that we talk about here are apps as such that can take care of the clinical diagnostics. The interesting app that my team is actually doing with one of very senior doctor, Dr. Satyan in Coimbatore, is we are actually developing an app for glaucoma, right? So this it's got a lot of potential because there are a lot of people suffering from glaucoma. There are other apps also. Let me show you the impact of this apps. So let's take, you say, okay, app for glaucoma. So the answer would be very simple. You would like to actually take a photo of the eye, right, through your mobile camera, and from there we are interested to find out whether the person has a glaucoma or not. Reason is, if you ask the statistics of how much of people are basically having glaucoma, you would be very surprised to find that most of the eye hospitals right now has started having a separate clinical lab for glaucoma alone, right? Let me ask this question for your inference being in Tamil Nadu. Statistics of glaucoma patients, right? Statistics of glaucoma patients in Tamil Nadu, right? Okay. If you ask, you would actually find the report will be very much not happy because the number of cases that you can find is increasing over the years, right? And it's got a lot of impact because you can always see here the possibility of glaucoma, right, can actually result towards blindness. Okay, so somebody says they have a high pressure or a sugar, and naturally, if it travels towards saying that the person gets a glaucoma, then there's a possibility that the person has a blindness also. So now this is more understandable at a place where we say that we are having access to a lot of facilities. But what if a place or a country or a location which does not have high access facilities? So there, an app as such can help the people there. A frontline worker can be trained on how to use the app. So a frontline worker is taking a photo, automatically it will say that the person has a glaucoma or not. 1 second. Okay. So this is something which I want to discuss in the first part of the session. So maybe I'll open up to questions. People have any questions we can discuss. Sir? Hello.
Yes, sir.
Yeah. So first part of session is over, sir.
Yeah, sir. I will unmute all the people, all the participants. Uh,
Participants, you have any questions? We can have some clarifications. So you want to get more details about me? This is a homepage of my profile at the institution side. So here you can go and see the different projects that I'm working on. So one of the project I was saying you is more about the glaucoma part. So that's called as Ansan, right? Which we are developing and we are going for prototyping also. So other products that we are working on from my team, you can see it under this web page.
Participants,
Any
if
questions?
you're having any questions, you can ask for this session. I have enabled your mic. You can unmute and you can ask, and also chat box is available for you.
If there's no questions, you can put a thumbs up symbol at least.
Yeah, sir, I think we will have
Yeah.
a break, sir, for 15 minutes.
Yeah, sir. Yes, sir. We can take some break for 10 minutes.
Yeah, sir. Yeah, we take it for 10 minutes.
We can
Yeah.
start 7:50, sir. Now is 7:40 time. We can take break
sure,
and
sir.
we can come with 7:50. Sir. Okay, sir. Thank
Yeah,
sir.
10
Thank
minutes
you for
after
your
we can
value.
start, sir, please. Thank you.
Okay, sir. Okay, sir. Thank you. Thank you. Thank you, sir. Session 3 is over. We can join after 10 minutes for session 4. Dear participants, you can stay in this group. We can start within 10 minutes for next session.
trial
Sir, am I audible? Am I audible? Hello? Sir, am I audible, sir?
You are audible, sir.
Okay, thank you, ma'am. Thank you.
Yes, sir. Audible, sir.
Yeah, fine. Shall we start?
Yes, we can start.
Okay, fine.
Sendil sir, whether we can start the next session, sir?
Yeah, I'm sharing, sir. 2 minutes.
Sir, whether my voice is audible to you, sir?
Sir, you're audible, sir. You're audible.
Faisal sir, yes, you are audible.
Okay. So let's start. I will share the screen.
It's audible, sir.
Sendil sir, whether we can start the next session?
Sir, 2 minutes, sir. I'm sharing the screen. Okay. So hope my screen is visible. I've shared the screen. So let us go to the next SDG. Sir, are we there? Hello? So please confirm.
Sir,
Am I
yes, sir.
audible?
Your screen, yes, sir. Your screen is visible, sir. Your voice is also audible, sir.
Okay. Now we will go to the next SDG, which is quality education, right? So when you look at quality education, the thought is ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. Okay, this is what they are trying to talk about with this SDG. Now, when you see the uh, SDG report, the challenges they are talking about is challenges with respect to kids who are in school, right? So there are a lot of kids who are in school. There are a lot of kids out of school also. That means they're not into education. Okay, though we say literacy has improved a lot, there is still a debate on, okay, are we still literate? Are we still convinced to say that, okay, whatever schemes that is being proposed, are they going into the requirements of the people? So we will take this SDG for our discussion. Okay, now when we look at this SDG, right, quality education, right, you can find that this quality education as such talks about many factors, right? So we will take this SDG and discuss. So SDG that we are taking is this one. Okay. Right. So here the SDG that is proposed is more about ensuring inclusive and quality education for all, right? So let's look at what happens in this aspects. As far as this quality education is concerned, people say the quality education can be enforced in two aspects. One aspect would be is like you should be able to see that many of the kids are participating in the education. First point. Now, when we look at this part, now the discussion is more about what is a participation rate in organized learning 1 year before the official age of entry into the primary school, right? As far as 2014 is concerned, this is the statistics that they have proposed, right? Right. So these statistics are more around the different countries, right from Africa, Asia, there, Eastern, Western Asia, New Zealand, then around the world, also the global statistics has been given. You can see that the participation rate in organized learning 1 year before the official age of entry into the primary school as of 2014, the highest that you can see is close to the value that you can find here. It has not gone to 100, nor if you can see if the average is around 50, not many countries has crossed an average which is more than 75% of the expected average, right? This is something which is proposed as an understanding discussion for this SDG here. So the point to be understood is every childhood as such, right? We assume that the child was as a cognitive development, right? So the cognitive development as such means the childhood is looked at perspectives of understanding what the childhood should learn and what the childhood should understand. So here there are three aspects here: social, emotional, and intellectual development of a child, right? Social, emotional, and intellectual aspect of a childhood. We'll take these three keywords, right? Social, emotional, and intellectual aspects of the childhood. Social first, then emotional, then next is the intellectual aspects of the childhood. Social, emotional, and next is the intellectual aspect of the childhood, right? So the this second is emotional, and next is intellectual aspects of the childhood. Okay.
Sir, Sendil sir, your
Yes,
voice
sir.
is not audible, sir.
Sir, am I audible? Surprised. Sir, am I audible? Hello, sir.
Yes, sir, you are audible, sir.
Sir, you said you are no, I'm not audible. Sir, can you confirm?
Yes, sir, you are audible.
Okay, fine. Sir, can we proceed? Okay. The next one is, despite progress in enrollment, more than quarter of billion school age children, adolescents, and youth are not in school, right? So if you can see here, this is a prevailing problem because a lot of kids they join school, but they are out of school. They are out of school or they are not continuing school because their interest has changed over the time. Now the statistics as such, if you can see, based on the gender aspect itself, you can see that there is a prevailing decrease, right, of the number of kids who are continuing the schools. So now this is something which is very much important to discuss. We'll spend time on this also. That means how can you make school kids continue their schooling? So we want the school kids to continue the school. So how do we make it possible, right? As people in research or people in work, can we contribute something here? Now, the next one is poverty, gender, and location of residence all influence reading the proficiency of the kids. So, as we can see here, when a kid is going to go to a school, the kid learns, and the kid learning is improving over the time from one standard to another standard. For example, if you watch your kids, you'd be surprised to see that your kid, when the kid is solving two numbers, let's take I give a number as 1 and 3, the kid is solving it and says as 4, you'd be surprised to see when the kid is in LKG standard. But once a kid goes to the third standard or a fourth standard, you will see the same kid solving mathematics more intelligently, saying, even if you give a 5-digit number, okay, I have a 5-digit number in the mind, I have another 5-digit number in the mind, I can add this 5-digit number and I can give you the result. So you watch your kids, you'll be very happy to surprise to see how your kid is adding 5-digit number, whereas the kid was just starting with numbers once the school has started right before a pre-KG. So the thought process here is very simple. Can a kid as such increase the reading proficiency over the time, right? So here factors that actually influences are poverty, gender, and location of residence will actually influence the proficiency. So I'm taking this also for discussion: poverty, gender, and location. Poverty, gender, and last one is location. Okay. Right. So if you can see here, the statistics being released, right? Okay. As far as the statistics says, more from the perspective of gender aspect, more across the girls, more across the rural regions, and similarly boys and richest, poorest people, you can see that the proposition is influencing somewhere, right? That means the kids actually join the school and they go till primary education, but once they go to a higher education, they are not continuing. That is one. Second category is in the primary education itself, they are not continuing completely the primary education. Okay. So this is something which is very surprising because government with a lot of schemes being imposed, they are trying to say, okay, every kid has to study till this age and there is no failures for the exams because of the exams, but still the kids' interest is becoming somewhat not okay. Let's discuss that also. The next is very important where people like us should actually think somewhere where we should contribute. Lack of trained teachers and adequate facilities threaten quality education for all, especially in sub-Saharan Africa. So this is something which you should actually think as basically as
Sir, Senthil sir, your mic is mute, sir. We are not able to hear you, sir. Senthil Kumar, sir.
Sir, Sunny sir,
Sir,
sir, Sandil sir, sir, Sandil sir.
participants, wait for some time. Guest is checking the mic. Wait for some moment.
Sir, am I audible now?
Yeah, sir. Now it is audible, sir.
Okay, sorry for the inconvenience. Okay, let's continue. Okay, what I was trying to say in summary is, because since the audio has been lost, we are talking about this SDG, that is ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. Okay, so when you go into this SDG and start seeing what are the related aspects that has to be seen, there are a couple of things that is proposed from the SDG side, which has been listed. From there, what I had taken up for discussion is, first one is the social, emotional, and intellectual aspects of the childhood. Second one, the school kids continuing the school, right, is still a discussion and challenge. Then third, what I have taken is these three aspects: poverty, gender, and location, also being contributing to saying that the school kids are not able to continue the education. I think it's not getting shared. Give me a minute, please. So we are computer science people. Sometimes we have problems. Okay. I think all of us are able to see the screen. Can we confirm once, please?
Yeah,
What?
yeah, sir. The screen is visible, sir.
Okay, thank you. Right. So this is what I was trying to repeat to you all. So we are looking at this SDG, ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. So there, the key things that I have picked is social, emotional, intellectual aspects of the childhood. School kids continuing the school, right, is big issue. So next is poverty, gender, and next is location. And next one would be is lack of trained teachers and adequate facilities threaten quality education for all, especially in sub-Saharan Africa. Okay, this is are the key points that I have taken for discussion. Now, what I was trying to show to all is there is a lot of research initiatives being proposed. One that people can target is submission of proposals to Ministry of Tribal Affairs because tribal based people are also looked for education where that for them the education is a key challenge. Okay, so that one second. Okay, so the tribal kids have a lot of challenge in education. I will also discuss to you on that. When you see the research activities that the Ministry of Tribal Affairs are concentrating on, you can see the first important one called as innovative technologies available for commercialization. That means, can you make some products where the products are going to be contributing to the tribal community and that products as such can be used for commercialization. This could be products related to the tribal people capabilities, or it could actually leverage the kind of education that is people are doing with respect to school kids. So you can see the list of projects that's been approved and it's ongoing. From my side, the happy thing that I would say is like I also completed one tribal ministry project. From my side, I also completed one tribal ministry project back 4 years back for 10 lakhs. So I have good exposure also in this kind of project, right? Okay. Now, what I'm interested in for people to see is there is a call where you can look at innovative technologies available for commercialization, right? Okay. And when you come down to this here, you can actually see the invitation for R&D also, where people can actually write mail for R&D collaboration also with the Ministry of Tribal Affairs. So there'll be a proper research proposal template which people can go through for applying. Okay. Now, what I'm trying to indicate for discussion is all these 4 points which I want to discuss, which has got a lot of importance today, not only with the tribal people, it's with normal kids also. Every living kid has this problem right now. Now let's look at this one by one. Social, emotional, intellectual aspects of a childhood. Okay. A lot of people actually have difficulties in understanding the statement. Even me, 2, 3 years back, as a parent, I also actually have a difficulty in understanding what they are talking as something which is very, very much technical or non-technical, right? So let's ask ChatGPT here. The social, emotional, and intellectual aspects of the childhood. Let's see what ChatGPT says for you. See, when you see the social aspects of the childhood, it is more talking with respect to the family interaction, right? Which is very, very much missing nowadays, where the kids do not interact mostly with the family, right? So the interaction with the parents, siblings, closer representatives is something which is very important. The next is the peer relationships. For example, the kid says, I'm going for a group play activity, right? I'm part of a teamwork, right? I'm doing something as a team, right? That's something which is concerned in the social aspect. The next is they also are interested in finding out whether whatever they do is correct or not. That means a kid is talking to another kid. The kind of politeness they have, the kind of politeness they learn from others is also very important, right? That is why you can see a lot of people will say that I'm taking my kids to all the general functions, or I'm taking my kids to all the places where I'm meeting my relations to know or to understand that the kid should know something from others, because everything we cannot teach, right? Somebody in the environment will teach. Something called the social aspects. The most important one is the role models. What do you learn from the people who are the peer community people? So here, people who we should actually look at pointing to would be the elders. For example, the kid would learn from an elder sister or a cousin elder sister and so on. Most of the kids also look at teachers as the role models, right? And next is the sense of belonging, right? People say, okay, I have an identity not as an individual kid. I have an identity because I fall into a group of my friends, right? Okay. So this are basically very important when you are looking at the social aspect. Now coming to the emotional aspect of the kid, right? The most important thing which people forget to see today are basically the emotional expressions of the kids. The emotional expressions of the kids mostly include why the kid is crying, why the kid is laughing, why the kid is angry, why the kid is joy. Reason is today's world, everybody is around a busy livelihood. Each one of us has a thought process that our work is important compared to the concentration or the time we spend for the kid. I'm not talking about anybody, I'm taking in general. So you can see lot of clinics right now coming up which talks about emotional well-being of the kid, right? So to give you an example, okay, I'll just put like this just for your information because this was not existing 20 years back. Emotional well-being clinic, right? Okay, emotional well-being clinic. If I put, okay, for example, I could see emotional well-being clinics being available at many places. You can cite around any emotional well-being clinic that you would like to talk about, right? Okay. So this emotional well-being clinics are coming up with a feedback saying that they try to make the kid calm. They try to make the kid composed. Reason is very simple. They say that the environment that the kid actually um, involves is not comfortable. That's what. The doctor's input is something like the kid has got all luxury at home, but the kid as such do not have their parents who talk to the kid always and understand what is the expression of the kid. So I'm leaving a point to all the audience, very sensible discussion here. The emotional aspect of a kid, right, which includes the expression of the kid, needs to be understood by the parents. Most important, right? Only then you can conclude that your emotional aspect of the kid is becoming better. But somebody would ask me a question, what if the emotional aspect is not okay, right? So I'm just putting this statement for your conclusion. Emotional aspect of kid, okay, leading to stress. Okay, emotional aspect of kid leading to stress. It will give you a lot of web pages saying why stress is happening, or the reason for the stress is again there's a big problem with respect to the emotional understanding of the kids. Okay, and to make it more very much important, right? If you add a keyword saying that emotional aspect of the kid leading to depression, right? Again, there will be inputs coming saying emotions and the development of childhood depression. Okay, so the interesting aspect is you don't find emotion of a kid not healthy or being monitored, then the doctors are saying that the kid as such may have a possibility to go into a stress or may have a possibility to go into a depression part, right? This is something which I have heard from doctors when we work on joint research. So I'm leaving this information as a common information for everybody. So the emotional aspect of the kid is more about how much they are happy, angry, sad, Or are they really happy? Are they really angry? Or the third way of asking the question is, are they really happy when they are supposed to be happy? That's something very important, which is very much challenging today. Is the kid happy when the kid is supposed to be happy, right? This needs to be understood. So if this is taken care, you can talk about the emotional aspect of the kid. The third one is actually the intellectual aspect of the kid. See, the intellectual aspect of the kid as such presents a lot of challenges today because the intellect is limited and the intellect improves over the time. That's what my individual opinion is. Because no kid is basically born intelligent, or some kids are born intelligent. You can take it like that, right? Let's take a kid at the age of second standard, summarizes 1,000 phrases in a poem and presents. The kid is a born intelligent kid. That's what I would say. Because you cannot teach a kid 1,000 phrases and make them to summarize, right? But everybody is looking at basically improving the intellectual aspect of the kid. That means how much I can make sure that my kid that I'm growing is speaking well in English. The kid as such is able to take inputs from others. The kid as such is able to have a good memory, right? Wherever the kid is taking some input, the kid is able to memorize. My kid is able to solve problems, puzzles, logical reasonings, right? Okay. My kid as such is able to have lot of literacy, right? So people go around activities right from the basic school activity to activity based learning, and every parent as such, is more about thinking how my intellectual aspect of the kid can be improved, right? Okay, fine. So this is something which people should know. So in summary, what we are saying is there are three aspects for learning, understanding of a kid. One is a social aspect, which is more about the family, and second, which is going to be the emotions. That's a cry, angry, sad, or neutral expression what the kid experiences. The third one, which needs to be understood, is the intellectual aspect of the kid, right? Okay. Now, the difficulties arises from one to another. For example, if you look at a social aspect of a kid, right? Today, the situations is like the social aspect is also leading to a stress. A kid says, I'm not able to concentrate in studies because my parents are not sitting with me. A kid says, I'm not able to concentrate in studies because I'm not happy where the environment I stay in home is not very happy, right? A kid says, okay, I'm studying, but I'm still not happy because there's nobody to clap for me, which is very important, right? Somebody should clap and say, okay, what you do is right. Even though the kid gets 60 out of 100, if a parent says, okay, 60 out of 100 is okay, it's a good mark, the kid will feel very happy, right? The kid will forget it is 60 out of 100, right? So the learning aspect of a kid starts from the social behavior part. So since this is happening, now what kids have started going into is kind of a gaming systems where the kids spend a lot of time with respect to the games or the televisions, and they or basically the reels, right? Whatever comes on the media, especially on the internet. And they watch the reels and they try to get some impact, right? So it looks as if that the kid as such is smiling not at you, but the kid is smiling when the kid watches a reel on the internet, right? Which is sometimes very much bothering for us also. So the social aspect of the kid is the first challenge in education part, correct? And second is emotional aspect of the kid. You do not know when the kid is crying, when the kid is laughing, right? Because the kid says, my parents are very much occupied, nor my parents would like me to smile, right? So here, this is becoming very much challenging because when we discussed with some doctors, they were saying that this is falling into a problem of something called as
Hello.
mental wellness. Hello. Yeah, this falls into something called as mental wellness. Sir, am I audible?
Yes, yes, sir. You're audible, sir.
Yeah, this falls into something called as mental wellness. Okay. So this mental wellness means something is not okay with respect to your general normal activities, right? And let's take, if somebody says there is a mental wellness problem for the kid, then naturally the other answer from the people would be is like, you need to go for some sort of mental wellness activities, right? Where people say you need to go for yoga. We need to actually look at some activities to make sure that you feel better. It could be a morning walk, or it could be a exercise together with the parents. It could be taking a brush, walking around the garden, looking at the garden and taking a smile and then taking a brushing, right? It all means about how your mental wellness is better. If this is also not okay, now what is happening right now is there is a dangerous comment from the society, especially the health community people who are monitoring, that the kid also might suffer from problems which might include stress. Okay, this is something which I want everybody to understand, right, in this process. So when you say your kid is safe, then you can also understand your kid is not safe in case you feel that the emotions are not clear, right? That's why doctors today are saying that you should watch the emotional aspect of the kid, right? So as a researcher, what you can do from emotional aspect, right? This is something which people can ask, right? So what we have been doing as part of research, we have not succeeded very well. What we have been doing as part of research is we are trying to see whether can you actually have a interaction system with the kid. Let's take the kid is okay or not. And now the question is like, can you understand when the kid is not okay? Possibly show something on the software and ask the kid to react. The software can actually caption a story where the story, I'm just putting it in small thoughts for all of you. In one of the beginning of the story, there are kids and the kids are playing. Okay. Now the kid looks at it and smile. Now in the next frame, there is a parent coming and beating the kid and pulling the kid from the play and taking for studies. Fine. Now, when the kid looks at it, if the emotion of the kid is changing from happy to sad, it indicates that there is a connectivity of the kid to the frame, what is being watched. I hope people can understand what I'm saying. So the kid feels like this. Maybe my parent is also pulling me out whenever I'm in a group play, right? Now, in the next frame, assume a case, the kid as such is studying at home, right? And the kid sees parents fighting with each other in the home. Now, the kid might look at that frame and become very sad. It might give an indication to the software that kid at their home is seeing some situations where the parents are fighting and the kids is not happy. So an emotional substance as an inference is not a content which is presented, but it is perceived content. I think you should understand that. A perceived content means in context of the environment, the kid watches something and the mind reacts to the content and the expression changes. So here the kid watches on the screen play, parents are fighting. Now the kid perceives that content and the intellect says, okay, I'm also seeing something like that. Then the kid's expression changes from happy to very sad. So this kind of understanding systems are part of research right now for all of you to know. Reason is when a kid is not okay in any emotional aspects, you cannot talk to the kid only with the counseling. The kid as such can be always interacted with softwares to understand why the kid is not emotionally happy, right? So this comes into kind of an aspect where you say that you are using a technology as a solution to understand the emotional aspects of the child. The third one is the intellectual aspects of the childhood. The intellectual aspects of the childhood is very much challenging today because every parent, including me, would have a lot of aspirations for the kid, right? And their aspirations increases from the 10th rank to the first rank in the class, right? And once a kid goes to the first rank, the parent would be aspiring to say the kid should get an outstanding rank in the class. Please understand my statement, right? My kid is 10th rank. I would like to go to the first rank. Once a kid goes to first rank, I would like to go for the outstanding rank. Now, this is keeping on a debating discussion for the kid because the kid as such feels the engagement of learning is the only thing the kid is doing. Please make a note. The engagement of learning is the only thing the kid is doing. The kid is not having other aspects where the kid's social behavior, emotional behavior is improving better. Okay. So this is something which is in most of the forums. So can you make a kid as such learn something, but in a more happy manner? Okay. That is where today's systems in pedagogy has improved a lot, right? For example, if you say that, okay, I'm going for learning how a brain is, right? Okay. So if I go and ask a chat GPT, okay, right? I'm asking ChatGPT for inference. I'm asking ChatGPT, can you show me products? Show products, show products that kids can use, okay, to learn biology, right? Right. Okay. Learn kids. Can the kids use those kids to learn something what the kids learn from biology, right? Then they will show you some lot of products which has come up in the market where where it is most important for you to understand it's a fun aspect. That means it's not going to be only textual reading. So once somebody works with such products, then naturally they learn the biology and they will also kind of look at possibilities of getting deeper insight. And over a time, it is possible that the kid will get an interest in that specific area, right? The interest will be kindled. That's very important, right? So recently, when I was able to see one product which was being presented by students, I was very surprised that they are looking at possibility of using solutions for AR VR, right? This is something that people in computer science can look at, right? Can you actually use augmented reality, for example, right? For right augmented reality for learning, right? Planets in space. Okay, right? Planets in space. This is something which is most required nowadays, right? Can kids actually use something which is an AI based software which is using AR VR, and with the AR VR are you able to show something which are planets, right? So this is something as a product which people are right now developing. Even you can also look at your institution and see, can you make a small software which allows a kid, right, to kind of learn the solar planets as if the kid can actually go inside the solar space and travel in the solar space and learn the different planets in the solar space. Okay, so what I am trying to summarize to all is education as a learning from textbook has changed over the years, right? And today, education as learning from the textbook has become better because we have tools to take care of it, right? That's the next discussion for all of us to conclude. So the first point is being discussed: social, emotional, intellectual aspects of childhood. So the need is each one of you can develop solutions, right, as products. I make it like this because it will take you to better recognitions. You can make solutions as products, right, which can be used by the kids, right? Solutions as products which can be used by the kids, right? So next is most important thing is school kids continuing the school, right? Okay, so government is taking a lot of policies. Government is educating kids by saying that okay, education is important. The government also gives a lot of um, freebies. Freebies in the sense, I mean to say, they give a lot of educational kits, right? They say, okay, there is a scope for you to have computers, right? Government says that okay, you can also have cycles. It's all to make sure that every kid actually comes to the school with comfort. And the government also looks at possibilities by proposing that they provide some sort of food meals also, right? In a way to say that if hunger is my problem because of which I'm not able to come to the school, you need not be hungry because the school as such will give you the food, right? This is something government is doing, and there are a lot of educational policies becoming better over the years. Okay, this is just thought process here. So as researchers, if you ask me what you can do, you can actually look at possibilities of looking at AI-based research, right? You can look at possibilities of using AI or AI algorithms, and you can say how AI can be used for understanding how the kids as such can be made to come to school. Okay, so this are all thought process here, and this is very much challenging in certain places because of the location, right? So when we did our uh, research, right, as part of the funded project, right, in tribal ministries, I think you should know that the government is becoming very much empowered, right? Okay, in a way to say the Kendra Vidyalaya schools, right? If you talk about the Kendra Vidyalaya schools for in tribal regions, if you can see here, you can see Kendra Vidyalaya schools have been started in tribal regions also. Tribal regions in the sense where you actually say the region settlements where the tribes also live, right? To point out in India, for example, especially in Tamil Nadu, we have KV schools which are running, especially in tribal regions which are close to Ooty, right? Ooty is a tourist place, but you can see that Ooty also has been promoted with KV schools by central government, where the focus is to promote people, especially people who are tribal settlements people also, or to provide education to the tribal settlements people, right? So this has improved a lot because the understanding is people there know that there's a government school and they get good education and they get quality teachers to teach them. One. But the challenge here is awareness of education, right? Though India as such has improved a lot, the awareness of education is not still reached to a very bigger place in certain places. When we visited certain schools in tribal settlement areas, the challenge that we found from the teachers is that their challenge is whenever they want to reach to a school kid in a tribal region area, the kid as such would like to come only for a meal. That means whenever the food is being ready, the kid as such will come and have the food and immediately will run back into a tourist place area. That means towards a forest. The same thing, the kid will come back whenever there's a play happening. Like for example, the kids are playing with each other and they are trying to do a play activity or a sports activity, the kid comes up. But when it comes to education, coming and sitting in the classroom, listening to the teachers and properly writing tests, no, the interest in the kid is not very high. It's not that the kid is not interested. The awareness of education is not very high. So the government is proposing schemes where the schools which are elite schools, which has been only in the premier cities, are coming to places to make sure that all people, including the segments of people who are in tribal settlements, also have education here, right? That is where I feel this point, is being taken care, right? Where we say the school kids are not able to continue school, not the school kids are able to not come to school because of their location. All that is becoming better because government is setting up a lot of better schools, right? Now the next one, which is very important to discuss, is lack of trained teachers and adequate facilities threaten quality education for all, especially in sub-Saharan Africa, right? Okay. So when interaction happens, especially with the people, as part of all these government organizations, mainly to say UNICEF, right? Right. So one of the focus in UNICEF is to provide education to all, right? Okay. So as far as UNICEF is concerned, they also have a facilitation for teachers, right? So wherein you can train students, right? Okay. So you can actually have the possibility to teach the students. So here, the UNICEF as such has developed a toolbox that you can see here, which is called as a Superstar Teachers Toolbox, which is developed by the UNICEF digital organization, right? This is kind of an accompanying kit, right? So what is this toolbox is? This toolbox says whenever the teacher as such is interested to teach to students, they can use this toolbox and they can have two important tools. First tool is something called as digital pedagogy, and second is called as mobile messaging for teaching learning process, right? So when you look at this digital pedagogy, the focus of digital pedagogy is whenever you are trying to teach something in a classroom, right? Using this software that's and using this toolbox, that is digital pedagogy toolbox, you can actually have proper objectives, assessments being provided, and wherein you can say, I'm fostering a social learning, right? So what is this social learning? It means that let's take a student as such is going to use this digital pedagogy. The student as such will be able to see the assignment, submit the assignments, and together they can learn. That means if you give a question, one student solves a question in one way of mathematics. The other student solves the same question in a different way in mathematics, but both of them give a same answer. It is important to know that both of it are correct. So two kids are doing two different practices. The possibility using this toolbox would be is to both the kids learn the concept from each other, right? The next is feature that is supported is something called as mobile messaging, right? So as far as this mobile messaging is concerned, here it allows the educators on using how to take mobile messaging platforms like WhatsApp, Telegram, SMS, whatever it is, for teaching and learning process, right? So where does it support, right? It is important that a kid as such, once a kid is learning, right, the kid as such might get small doubts or may get stuck in bigger doubts also. So here, the kid as such can take the support of any WhatsApp, Telegram, or SMS and learn. See, generally when we talk about all this social media messenger apps, one general debate is like social media messenger apps are only for communicating images, social talks or something. But please also understand, in all the social media apps, including you say WhatsApp, Instagram, whatever it is, you can see an educational community WhatsApp group also exists. So people go into this educational community WhatsApp group, they see peers who are in the education coming inside the group and discussing on different aspects, right? And a person rightly lands into a proper learning group, which is an educational community group, then the person learns, connects, and also becomes a good intellect as part of the WhatsApp group itself, right? I'm still pointing, if the person joins a right educational group in WhatsApp or Instagram, then the person becomes an intellect. So choosing the right group or right peers is also very important. Now, as far as this toolbox is concerned, it is said that using this toolbox, you can actually teach kids and so on. Since UNICEF caters to people, especially in the socially backward areas or backward countries, this toolbox is also suggested for reference. If people want, actually, they can download this toolbox also for your reference here, right? So this toolbox as such, as said by the head from UNICEF, he says that this toolbox as such will equip teachers to become superstars. Okay, right? The teachers will become superstars if they use this toolbox. So even if you want, you can download this toolbox and use it for school teaching also. Now, one what I'm leaving as a point is when you can actually download this toolbox from an academic perspective, right? What I insist in most of the forums is you should actually look at developing a toolbox like this, right? You need not develop a bigger picture of a entire toolbox, but maybe you can actually take the smaller part of it and develop a toolbox, and from there you can add more information over the time, and finally you can say your toolbox is well prepared for usage, right? Okay, so this is something which I want people to know, right? Then if you come to this next one, lack of trained teachers. Okay, so lack of trained teachers as such, it is a policy from the government that the teachers need to be going for certifications, empowerment programs, educational programs to make sure that they are being trained. But however, if you see today, right, if you ask the chat GPT, recently I saw this, right? Okay, I want people to actually see this also, right? When I was preparing for this presentation forums, right? Okay. So how will school, okay, change, right, in AI, change with AI? Okay. Just asking this question, right? Okay. So this will say, don't worry that the AI as such will know where you're weak, where you're strong. It will give you personalized learning, right? There'll be going to be AI tutors like what we have nowadays, right? Okay. You go to ChatGPT, you type a code, the code is being automatically corrected by ChatGPT also, right? So you have 24/7 assistance, right? Then you can actually see attendance, everything being monitored. Then you will have a lot of teaching tools which are using augmented and virtual reality. And this important keyword, inclusive education, that means AI can translate lessons in real time using the concepts for multilingual classrooms, right? Okay. So there is a possibility that if you have a class, the class as such can be transcribed with text, right? That means the speech is converted to text or the text is converted to speech, right? Both of it will be helpful to the students, especially with disabilities, right? This is a very key factor in inclusive education. And next, if you can see here, the critical thinking, where kids will be able to think better, all that. So here, I'm asking the second question, right? Will there be school teachers, okay, in future classrooms in school? I'm just asking this question. Let's see what ChatGPT is there. Okay. Yeah. See, teachers will guide students in applying knowledge, right? And the teachers, as such, will have possibilities to look at the emotional aspect of the kid because AI cannot replace human empathy, encouragement, and emotional care, right? Personal mentorship, AI may track student progress, but teachers will interpret the results, right? To know that there's a personalized mentorship. When it comes to collaborative learning, the teachers will organize discussions, debates, projects, and teamwork where human interaction matters a lot. The same when it comes to curriculum designs also. AI might suggest lessons, but teachers will decide teachers will decide what relevant content the students can have, right? So finally, for your conclusion, AI will be an assistant which will explain the concepts, gives practice, and will try to track the progress. Teachers will be leaders, who will be a mentor, who will be a motivator, who will be an inspirer, and who will shape the character of the students. So this should be a good news for teachers, all of us, that in future, though AI will exist as of now, what ChatGPT says, we will have teachers dominating AI because teachers will have a big role to take care of the student community. So the conclusive part I am keeping in remark is as part of the SDG here is to look at the inclusive and the part of education support you want to give for the school kids. You can look at development of technologies which will take care of looking at their emotional, intellectual, and also social aspects and make sure that they keep smiling all the time in this education. So that's it from my side, sir. I'm done with my session. Any clarifications from the audience, please, you can ask.
Thank you, sir. Thank you for your valuable session, sir. Uh, Sir, just a minute. I will enable all the people participant to participant. You can ask any questions regarding this session. You can enable your mic and you can ask, or you can put in chat box.
If there are no questions,
If you have any, if you have any doubts, you can mail to that mail ID drtsk111@gmail.com.
you can very well reach in my official email ID also.
Sir, can I know why medicine and law are not incorporated in school studies? Medicine and law.
Okay, fine, sir. Why medicine and law is not incorporated in school studies? Okay, that's a valid question, sir. So the thing is, over the time, if you can see the kind of education that we are all seeing. Okay, I'm just talking about me, right? If you ask yourself, have we given any information related to history, geography, leaders, right? Okay. Answer would be yes in the past and also present. Am I right, sir? Right? All of us learned about history of buildings. We learned about the different leaders and so on. Now, today there is a big awareness coming up saying the kids as such also need to know what sort of things are risky, especially with respect to the kind of access to mobiles and so on, which falls under the cyber threats. So there is discussion forums talking about saying that can we have kids also know to know something about cyber threats also, because they use mobiles, but they should also have awareness that the mobiles may steal some information from them, or they might steal some information from their family. So slowly the cyber threat based input also are being thought about whether they can come into educational forums or teaching. But in future, we will always see possibilities where law also might come up, because India as such, to my opinion, okay, India as such, to my opinion, kids as such do not go into any sort of a law or a complaint sectors. But if you talk to certain countries, the countries laws demand saying that a kid as such being beaten at home can actually file a complaint against their parent calling through a helpline number, right? India is not like that till now. So laws are not much in practice, or the kids also do not know much about laws. Maybe over the years, when our way of living, when the kids way of living together changes, then that might come into practice in education also, sir. Medicines as such, the medicines, I think it's not like it's not being taught, sir. It is being taught from saying, okay, what are the plants, what are the what are medicinal plants, what are non-medicinal plants, but they have not gone more into the type of importance of what we India is very special on, maybe the Ayurvedic plants or the type of healing aspects the medicines can provide. That has not come in. Maybe I think that is in the college level. Uh, I think over the years it might come to the school level. Sir, am I audible? Are you able to hear me?
Yes, sir. Yes, sir.
Yes,
You are
sir. Yes,
Yeah.
sir.
audible.
Yeah. So, like for example, if you ask me, how many of us have thought, how many of us have really thought that AI will become a subject for the school kids, or machine learning will become a subject for the school kids? 5 years back, nobody would have thought of it, right? But today it's not like that. Even a seventh standard kid is having AI, or the textbook is saying think AI. Okay, right? You see the textbook cover is saying think AI. That means the kid is asking what is that AI. So an awareness in about AI is coming to a school kid now in 2025. Maybe in future, maybe as you say, the law and medicinal aspects also may come into the stream of education, sir. That's what I think of. That's all.
Yes, sir. Actually, what you are saying is right. But what happening in reality is different. Actually, school kids are not allowed to ride the vehicles, bike, everything. But most of the school kids are at the age of 15, they start to ride the bikes or even car. And look over the drugs. Most of the kids are starting to smoke at the school age. So they are not aware of these things. Is everything is not allowed. Without helmet, they are not eligible for riding the vehicle, but they are riding the vehicle.
Yeah, what you say is right, sir. But what I'm seeing at my peer community is every parent as such wants to make every kid comfortable or get the kid what the parent has not enjoyed. Okay. So in the process now the kid is having a social comparison. That's becoming a problem nowadays. Social comparison at the school itself has started. For example, in my opinion, what I would say is like, let's take there's a new mall that's opened. Okay, I don't know from which place you are. There's a new mall that's open, and let's take you've not taken your kid for more than 2 months. You expect the same kid to come to you and ask, okay, my classmates have gone to the mall for 3 times. I'm not going. So that becomes a social worry for them. Okay. So the parent is also inclined to maybe take the kid like that. Small, you can call this a mistake also, right? Becomes somewhat costly in life when they get into different character habits. That's really a risky situation, sir. Now that's where doctors are saying that when I listen to one of the talk, from one of the senior lady police officer in the open forum in the school, she was saying very nicely one statement: every parent as such should carry a third eye as far as the social awareness is concerned. She says you come home, you are very busy, but still your third eye should watch what your kid is doing around the home, right? The kid as such may take your mobile, the kid as such may go and think something, but your third eye should be watching. There should not be any reason saying that you are tired or you're occupied. This I heard from one of the senior police officer 2 years back. I also got a learning. Okay, maybe I should carry a third eye at home, right? Watching the kids. That's what I would like to say, sir. Because the future is very challenging for the kids because they are accessing everything, and as you say, the rules and regulations sometimes they don't respect at all. So that's it, sir. I hope I've given you some inputs which I know that's so.
Yes, sir. Thank you.
Yeah, thank you, sir. Thank you.
Any questions from audience? Dr. Sanil Kumar, sir, thank you, sir. Thank you for your valuable session, sir.
Yeah, and I would like to keep one closing point. See, the sustainable goals is one of the area which is attracting a lot of research funding. So if you are a researcher, you are engaging for funding or looking for funding, please make notable publications in that area in the sustainable goals, right? Any of the SDG goals you can concentrate, maybe with a research paper, then slowly you can make a small product. Then you can look at how that product can go for a commercialization and slowly pitch for funding. Okay, because this most of the conferences or funding schemes are looking at the SDGs nowadays, right? And that's it. So thank you so much from my side. Thanks to Dr. Kiran Bala sir. Thanks to the professors at Ramakrishna Institution and principal for considering me for the session for today. Thank you. You can always reach me on mail. Maybe if you would like to connect or collaborate also. Maybe if my expertise can
Yes,
help
Professor.
you.
Thanks a lot, Professor.
Thank you.
Yes, Professor. Thanks a lot, Professor.
Thank you, sir. Thank you so much, sir.
Really, the session was very, very nice, Professor. We all enjoyed it.
Thank you, sir. Thank you.
Yes, Professor. As usual, you
Thank you,
are
sir.
rock,
Thank you.
Professor. Thanks a lot, Professor.
Thank you, sir. Thank you all. Good day. Thank you all.
Participants, we have given a feedback link in your chat. You can fill the feedback link, and also I will put the feedback link in the WhatsApp group also. It will be active till night, 11 o'clock. You can fill the feedback link. The attendance will be monitored in the Microsoft Teams software automatically. Thank you, participant. We can meet tomorrow for next session, session 5 tomorrow sharply at 6 p.m. Thank you, participants.
Thank you, sir.